Hey friends, here's an update. It is Thursday the 25th. It is 2 days after I've had conventional treatment. I usually get back to you guys a little quicker, and I'm sorry about that. I've actually been feeling pretty good. So that was the second round, the day 3 of the second round. So the last chemo round of the second round. So I have hopefully one more round is my goal, is to only have 3 months of conventional chemo. I will probably be keeping with the Herceptin and the Perjeta longer to be still attacking the HER2 to allow my immune system to keep attacking it, I suppose, but to allow it to be present. But hopefully chemo not too much longer, so that'd be great. I had all 3 this last Tuesday, so my mom was there to take me. And you know, we started out with the pre-meds, and then they hit me with the Benadryl, so I was out. They hit me with the Herceptin, then they did the Perjeta and the Taxotere, and the Perjeta and Taxotere I put on my cold gloves and my cold socks, that's recirculating, and did my eye wave on my liver, and it went great. I pretty much slept through the whole thing. Getting used to that kind of feels like a whole wasted day, but I know this is necessary to treat myself. So I'm trying to get over the fact that it feels like just kind of sitting around in a chair all day. But Monday was also sitting around to get to Mistletoe to Atlanta. So, you know, but that went great as well. Drove down. It's just kind of fun down there. They're all like a little family. So got to try my first yarrow compress on my liver. So Enid did like a yarrow tea, and then they like soaked it, and then they put the fabric on my liver and then wrapped it and then put like hot water packs on that. And I got to lay there, which was really nice. I got to take another nap in the afternoon. It was lovely. So that's supposed to help the liver deal with everything. So I'll be doing more yarrow compresses in the future. It was a good way for me to kind of get a feel for it and to see what it felt like and how to do it really. So I'll be looking forward to those moving forward, just to keep my liver as happy as possible. Some of the things I wanted to mention today were my infrared sauna. You know, some of the things I did early on when I was diagnosed with cancer was a lot of research on hyperthermia. And hyperthermia is the opposite of hypothermia, right? So we're dealing with the hot side. So when the temperature of the body is getting hotter than its baseline. When you're trying to approach cancer and you're using hyperthermia, you really need to get your numbers up pretty high. I mean, as far as, you know, actually killing cancer, the tumor area needs to get over about 108, and I think that needs to stay at least an hour. But I have found conflicting research on that. So for the eye wave that I use, which is a hyperthermia unit, I have to keep it on for 60 minutes. And it heats the organ of interest deeper in the body, so my liver. I can do the breast too, but I try to focus on the liver right now because the tumor area is changing pretty quick, and we want to make sure the liver is also staying up to speed. So it targets the liver and it makes it, you know, 4 to 6 degrees hotter in the tumor than it is on my skin. Other countries will use hyperthermia where they'll heat you up and they'll keep hydrating you as you're really hot because you are sweating. And then they'll wrap you and have you, you know, go to bed sometimes or sleep, and they keep you all wrapped, or they'll make you take a shower in between, a hot shower, and then wrap you up again. And there's this way of like pulling things out of the body. You know, they'll talk about the sheets that you're wrapped in. They're white to start, and when you're done detoxing, they're like nasty and brown and yellow, and who knows what comes out of your body. And you know, and I don't know, there's a lot of talk about that being the most effective hyperthermia approach, though I still think people get really good hyperthermia changes with infrared saunas. Not only the wooden one, like I've got one you can actually go in, you sit, there's, you know, the infrared pads all over, even lower against the side walls. It's a really good even heat in the one I've purchased. You just have to be really careful where you buy these because you could be buying a giant microwave. That's kind of the worst case scenario as far as what I came across with infrared saunas. I think the best research is truly on just the typical dry saunas and some of the other countries, the Nordic countries that have studied this on men's health, for decades of time. Just showing that it really does increase the longevity of people. Mostly the studies have been on men. So it's extremely helpful for heart health. This is basically a low, moderate form of exercise where your heart is still being challenged, but your body isn't necessarily being pushed, so you're not having to wear through the joints. You're still getting a good cardiac kind of workout without kind of tapping into overuse injuries and things. So saunas are a really big deal in a lot of other countries. I got this infrared sauna. This company's out of Canada, and they're super clean, no glue, quickest thing ever put together, and it's awesome. The wood is non-toxic. You have to be really careful with stuff like that if you're going to pick one out. Don't get your sauna at Costco. If it's $1,000, it's probably not a good infrared sauna. Infrared, it's one of those things that it's heating you, not the air. So it's really heating your body, kind of like a microwave. So you want to make sure it's doing that at the right rate. There's just some factors to play into. Not to mention the glue and the toxicity of the wood. All these things can be bad for you. So anyway, I did a ton of research before I bought this one. I'm really glad I have it because I used it a bit, but I didn't dive in the way I really dove in when I was diagnosed with cancer. So I'm really fortunate to have one. So I hopped in this thing pretty much every day. I tried to use my sauna every single day, especially in the beginning when I was just trying to bring my core temperature up as much as possible. Because the more you can strain your body and kind of make your environment less hospitable to things, your healthy cells can survive, but the unhealthy cells can't survive as well. So you want to stress them out. So same thing with like dropping your blood glucose and things like that. That stresses out the cells, especially the ones that are weak. So infrared saunas are really cool. It also came really handy when I was doing mistletoe, or I am still doing mistletoe, but it comes in handy when I was trying to elicit a fever. So a fever, people think that you want to cut a fever really quick when you're starting to have a fever. But the whole point of mistletoe, the form that I was doing was to induce fever. That's why I was doing the injections in my belly. So I was trying to induce fever to get my immune system, my natural immune system to, wake up and start fighting. So you want to get that. The fever is simply the hypothalamus raising the core temperature to try to cook out whatever pathogen it thinks it's being faced with. So again, hyperthermia, right? We want to try to cook out that pathogen. Cancer can be one of those things. If we can raise the body temperature, cancer doesn't want to be in that environment. So it's stressful for it, so it helps. So I did a lot of that right after mistletoe, the few days after, just anything I could do to just pull my core temperature up so I could tip into that fever breaking zone. And it gave me really good changes, especially early on in the tumor, the softening, the clearance, the rate of which my lymphatic system was able to move. Because often, for my sauna, it takes about 30 minutes to heat up. I kick it on, I do a little workout in my office, a little mobilization, maybe some rowing, whatever. I get into my sauna, I do some myofascial stretching if I'm up for it, a little bit of L-DOA if I'm up for it, which I usually will do some of the cervical L-DOAs. The hip L-DOA is fine. I have a 3-person sauna, so I could lay down flat in that and throw my legs at the wall and do an L5S1 L-DOA if I want to. So I'm pretty spoiled. So this was awesome to have. Currently, I am not using it very much, which makes me kind of sad. I really missed it, even though I do not enjoy being hot. I don't really like dripping sweat. It's not my favorite feeling. I prefer to be on the colder side, but I got really used to it and it felt really good. Like my body really needed it. Like I should be sweating, Sweating is a natural way to pull toxins out of the body. I don't like throwing around the word detox very much, but it is sort of a detoxer for the body. Sweat is a big deal. And, so I think it's really helpful for that use. I think saunas could be, there are ones that people get, like they wrap around their bodies and they keep their heads out. There are saunas that talk about that and they don't like heating the head. So I don't have that luxury. My head is in this thing, but some people I think would be more comfortable if it was heating their body and less their head. So I don't know. For me, the information's out on that. It hasn't been well researched because there's not a ton of money in it. So I'm just kind of giving you all the options of the stuff that I came across. I think ultimately, if you already have a sauna, having one is better than not having one. Even if you don't have an infrared, which is really just far infrared light, it's invisible to the eye. I've got light therapy. I have color therapy in there, which is fun. I just put it on the one that's switching all the colors right now. And this one has zero Bluetooth, no EMF, which is wonderful. But I think ultimately, as it's kind of switching around back there, you're not going to see the rays coming at you. So if you can't get an infrared sauna and you don't know the quality of what you're getting, I'd probably just go with a dry or a moist sauna that you can have like a steam kind of sauna effect, because the heat alone is great. The difference is that if you're in one of those saunas, you're looking at the temperature getting 180 and up versus this thing that tops out at 149. So it's a lot more comfortable to breathe in. It's still uncomfortable to breathe, but it's a lot more comfortable than 180. But again, those are the saunas that have the best research. These are just coming up and about. They're starting to get great research. So we'll see in time, but so far I'm a big fan. I feel really good and energized from it. I can't do it right now with chemo because I'm not allowed to be detoxing around the days of chemo. So I'm trying to, oddly, keep this stuff in my body and so it can get to where it needs to get to. So if I do sauna, which I have laid off it big time, but if I do it right now, I could do it on Saturday evening, Sunday morning, maybe Monday. But again, I'm gone at Mistletoe Monday. So I usually have done it like Sunday night if I'm going to do it. That would be the same if I was to do a coffee enema, which I have also laid off currently because I don't have any issue, with motility right now because chemo is doing its wonderful work. Luckily, I'm not too ripped apart in that department. It's been fine, thank goodness. But I have a feeling that I don't need to tip the scales and go any further with it. I also don't think I need to intuitively tax my liver, which is the reason why I was doing coffee enemas, was to get the liver to release a bunch of antioxidants and to really boost my body's ability to kind of fight. Right now I might just let the liver do its thing and we might just focus on the back end coming at it from that angle. The back end, oh, that's funny. But we might come from that angle if we need, to kind of get the liver to function a little differently down the road. Right now, I think it's doing a lot. So I'm trying to just do some herbal supports and things on the days off of chemo, a little bit further away from chemo, which should be its highest concentration the first kind of 48 hours after I get it. That's when I really focus on making sure my eye wave is going on, I'm getting the heat so I can direct the chemo where it's gotta go. After that, I can start doing some of the other protocols. So, I got one more month. Next week is gonna be Herceptin only, so it's kind of an easy week. And then the month after that of May, I've got 3 more chemos, 4 more Herceptins, probably 2 more Progettas somehow in there. And then I'll probably follow through with Herceptin and Progetta and hopefully be off Taxotere for a while. I'm really hoping. I've set my PET scan for the 23rd of May. So that Thursday, it's right after, 2 days after my last Taxotere. So we'll get the PET scan, we'll see where we're at. I'll get an appointment with my surgeon and kind of see what she's thinking. Hopefully I'll be a good candidate for surgery so I can move forward with that. And then I wanted to announce that I am going to also look for other therapies, not just lean on chemo. Of course I'll be doing supportive therapies and I can describe all the things I've researched. But one of the really interesting ones you may have not known about is called, I'm probably going to botch it now, but histotrypsy. It's basically like, think of like lithotripsy, like when they blow up kidney stones and things. This would be cell trypsy, blow up. I think that's loosely converted to that meaning, but basically blow up cancer cells. So it's like a frequency type device, like an ultrasound looking thing. So I'm hoping that is going to be something on my radar down the road if I need to approach the liver. I think it's only been really well researched for liver tumors. So If you're out there and know somebody with a liver tumor and they're looking for alternative therapies that doesn't involve chemo, that has pretty good research behind it, the histotripsy might be something to look into. I've seen it in Chicago, and there's actually quite a few facilities that look like they're doing it now. So that might be something on the horizon to toss into the mix. There's a lot more options than just chemo. I'm trying to use it to just shrink the tumor and then move forward with that. So wish me luck. I guess that's a pretty good update. I hope that gave you some good information on infrared saunas. I did so much research years ago on this thing, so I feel bad because I know so much right in the moment when you're researching something, and then take a few months or years away and it kind of just dumps. So I hope I did it justice. There's great information coming out about these things. There's also really great information on the old style saunas. So if you have one of those, don't go out and feel like you don't have what you need. You can make do with a lot of stuff. This is all about just changing and stressing the body through temperature. A lot of people get into the cold plunges. That's another way to stress the body with temperature. So, at some point that might be something I mix into my routine, is a little bit of both, back and forth, and stress this sweet little body out of mine just to kind of keep it guessing. That's the goal. Make yourself adaptable. So I hope that was helpful. I'm kind of going off script on all of these. I'm sure that's obvious. I'm usually a really well-researched person, so if this feels a little tangenty, it probably is. I'm hoping that when I'm not on chemo and not trying to heal cancer, that I will be able to put together some really well-organized videos that are a little bit more upbeat. I guess not upbeat, but tidy. Let's say tidy. So anyway, thank you so much for your time, for hanging out. I'm feeling pretty good today. I was able to see some patients yesterday and today. I'm hopeful for tomorrow. We're just over halfway for the chemo treatments. So I think 5 out of 8, because the 9th one was canceled. So, that's pretty good. Wish me luck. Hopefully June I'll have more wiggle room, but obviously I'll be updating you guys before then. So have a great weekend, and take care. Keep learning. Bye-bye.